to thank everybody from West Virginia and all of you who are involved. I'd like to give another quick thank you to the panelists, and I want to thank Chris and Dan and Shelley, Marty and Jason, who represent great organizations across West Virginia that work tirelessly to protect the healthcare access for all West Virginians. And I appreciate the invitation to speak with you on the importance of ensuring that West Virginians have access to affordable, reliable healthcare. It's something that we all need. Each and every one of you have worked diligently over the past year to help your fellow Americans through the most difficult times with COVID-19 pandemic, which continues to be one of the most pressing issues facing America, especially as new variants emerge and further strain our healthcare system. Our healthcare system and our healthcare providers have been on the front lines for an awful long time responding to this crisis, and it's been over 2 years now. Ensuring healthcare providers have the tools that you all need to care for our fellow West Virginians is extremely vital. And the affordable, reliable healthcare coverage provided by Medicare Advantage, it's essential to keeping West Virginians healthy and safe. I've consistently supported the Medicare Advantage program, which provides quality healthcare to more than 27 million Americans and seniors and individuals with disabilities nationwide. Without Medicare Advantage, more than 180,000 West Virginians will be without good healthcare coverage, and they rely on Medicare Advantage for every day. Recently, I led a letter urging CMS Administrator Chiquita Brooks LaShore to continue supporting the Medicare Advantage program for West Virginians. And in October, I announced more than $671,000 from CMS to help the West Virginia Insurance Commissioner increase and improve health insurance coverage options in West Virginia through additional outreach and consumer protection efforts. This funding is going to help West Virginians find the best insurance that fits their needs, including original Medicare and Medicare Advantage options. Helping West Virginians find healthcare coverage that meets their needs and their families' needs is crucial to the well-being of our communities and our entire state of West Virginia. Many Medicare Advantage plans also offer supplemental benefits that are not included as part of the original Medicare, such as fitness programs, gym memberships, and nutritional home meal deliveries. Unlike original Medicare, Medicare Advantage plans to take a holistic approach to care by addressing social detriments of health to better meet seniors' needs and improve health equity. Over 95% of the Medicare Advantage beneficiaries have access to meal services, telehealth, transportation, fitness, and other additional benefits through the Medicare Advantage plan. So many Medicare beneficiaries in rural areas opt for and rely on Medicare Advantage plans to receive their Medicare coverage and other benefits because of the flexibility that these plans have provided for them. And on top of all these benefits, research shows that the average Medicare Advantage beneficiary saves $1,640 a year in healthcare costs compared to traditional Medicare beneficiaries. So in 2022, 65% of Medicare Advantage beneficiaries are enrolled in zero premium plans, and the average monthly Medicare Advantage premiums will reach historical low premiums, all while the availability of supplemental benefits continue to increase. And this is great news for every West Virginia Advantage plan. And I'm pleased to see these benefits increasing for our fellow West Virginians. And I don't need to say a whole lot more because you all know everything anyway. And all we need to do is work together to make it better for West Virginians. Continue to speak up. Continue to tell them about the threat of what would happen if we nationalize everything, if we governmentalize everything. It basically takes all self-responsibilities away from people to where they got to make some decisions and take better care of themselves and do routine maintenance and things. That's a responsibility. And basically the private sector gives me an incentive to do that better than the government ever has.
Certainly being able to support Medicare Advantage plans has certainly allowed West Virginians to pick and choose flexible plans that meet their needs through Medicare Advantage. So I applaud you for that, because I think that is what's needed. Healthcare at times can be very personalized, and allowing Medicare Advantage to offer different plans allows individuals to make that personal to their particular situation.
Thank you, Senator. Thank you, Kelly. I came to West Virginia in 2005 from Pennsylvania. I worked at a Y there for approximately 2 years, and they had provided during that 2 years I was there the Silver Sneakers program. So that was when I came to West Virginia to the Track YMCA. That was one of my goals, to bring that program here. We were able to do that late 2006. We have seen that program grow tremendously over the past 16 to 17 years. In that time frame, we've been able to add a couple other programs that are partnered with some other Medicare Advantage plans, Renew Active, and Silver and Fit. Not only does it give them access to facility and exercise equipment, fitness programs that they otherwise would not, due to many of these seniors are on fixed incomes. COVID was a big eye opener when it came to both of those aspects, the health and fitness, as well as the socialization. We saw many of them when we were closed, everything was shut down for those couple of months. When they came back, many of them had deteriorated tremendously in their health and fitness. So many of them have come back. They're starting to work their way back. Every month, usage and participation is increasing. But there are a few that we haven't seen since before COVID hit. Once they became inactive over those few months, some of them now aren't able to leave their homes, or they've now been transitioned to other facilities.
In 2008, the state was faced with a $7 billion with a B liability for the OPEB plan in the state retiree health benefit plan. The state was one of the early adopters of the MAPD. It was met with significant resistance from both credit agencies and retirees. The finance board meeting where we adopted movement to the MAPD had to be moved to a conference room in another location to support the amount of retirees there to protest the decision. 14 years later, the state is now close to a fully funded OPEB liability, and the retirees were protesting the possibility of losing Humana, their MAPD provider. So I think just those two situations over a 14-year period.
Jason,
really
I remember it vividly. Kelly remembers it vividly. We were the ones catching the spears.
Yes.
Had to make some changes.
Yes, we did. And they have now turned into they love them. They love the MAPD. They get more attention. They get more customer service, more benefits, and at a better price. So the fact that we used to have a looming $7 billion OPEB liability to now being fully funded is almost primarily due to the cost savings that we've been able to achieve through the MAPD and keep a very respectable level of benefits that any retiree would be happy to have.